do focus around the entire country, and some of our work is really, beyond our campus work. Some of the work is really about helping healthcare providers understand complicated research and just generally providing information about EC. Well, I think it will become, more and more important for people to be able to access EC. Unfortunately, there hasn't been a lot of interest on the part of the donor community in EC in years. But I'm hoping that there will be some renewed interest as people realize that we need to do everything we possibly can to help people prevent pregnancy before it happens. And there are so many barriers to accessing EC that just don't need to be there, and yet are. And one of them, of course, is the cost. Even though Plan B and the generics, Plan B are available, should be available over the counter on the shelf that anybody can just come and get. It is much easier in many ways to get it, but it's so expensive. It costs $40 or $50 at the pharmacy. And just so many people cannot afford that. And it doesn't have to be that way. We encourage people to buy it in advance. So you can buy it online from different companies. There's a company called Afterpill. There are several companies that sell it. Walmart sells a low-cost EC online. It just doesn't arrive the next day. And so you have to make sure, A, that you're buying a reputable product, and B, that you know that you have enough time. So it's important to take EC as soon as possible because it's more likely to work. So we really urge people to have it on hand, buy it for $10, have it in your medicine cabinet, and then you have it whenever you need it. The range of, a temperature range, so it can't be too hot or too cold, but it's just, just like any other, regular medication. It's, the expiration date is, obviously one of the most important things to keep an eye on. In addition to Plan B and its generics, there is also a prescription form of EC called Ella. And so it's a more effective product. It works closer to the time of ovulation. So we recommend it for, it's particularly for people who are close to the time of ovulation in their cycle when they have unprotected sex, if which most people frankly don't, or for folks who weigh more than 165 pounds, because there is some evidence that the OTC forms of EC are not effective for people in those heavier weight categories. The benefit of using Ella is that generally your insurance should cover it because of the Affordable Care Act. It's still the law of the land, and its FDA-approved contraceptives are covered. There are some questions about, whether plans have to cover Ella and Plan B. I think my understanding is that they do. So that's one benefit of using Ella. In states that have a contraceptive coverage mandate that includes OTC contraception, so that means that your plan would be required to cover Plan B or without a prescription. Those programs are fantastic, but they are difficult to implement. The implementation phase has not been as robust, I think, as they were hoping. So there's a lot of work to be done on the insurance front, but it is, if you know that you have a prescription, it's a really, really great benefit to be able to use that. One of the challenges with Ella, I'll say, is that pharmacies really are not stocking it. Even though it has been on the market in the United States, studies show that pharmacies do not keep it in stock because they don't get. I've done work, research showing that healthcare providers don't know about it, and so they don't write prescriptions for it, and then the pharmacies don't stock it. So it's kind of this vicious cycle. I am hoping that it will become more available everywhere because it is a more effective option. And as we move forward, having the most effective option available is going to be incredibly important. having the ability to have a stockpile of EC on hand would be so valuable, and you can get it for a lot less. I did a review article with some colleagues. I think it was published 10 years ago, 2012. Wow. And so we reviewed all of these different articles about different kinds of IUDs, non-hormonal IUDs used as emergency contraception. And, more than 7,000 cases of people having an IUD insertion after unprotected sex. And I think there were 13 pregnancies or something. I mean, it's incredibly effective. A lot of people are really uncomfortable with an IUD insertion. I also work on medication abortion, and so I think a lot about these in that sort of big picture of reproductive health access. And what I've seen in my 24 years of working in this field is that I guess I don't put anything past people who oppose reproductive rights. Having the ability to use your insurance without parents finding out just seems so important. But it's hard, and even for a young person, I can imagine that they just may not trust the system, even if they have insurance, even if somebody tells them it's not going to be on your explanation of benefits. Legislation that says life begins at conception, which is not a medical term, but I generally understand that to mean fertilization of an egg. I can see a scenario in which they take that to the next level and say, okay, well, it looks like EC prevents implantation of a fertilized egg, which the best available evidence says is not true. But I can imagine in those kinds of situations, there may be difficulties with EC access in limited situations. But because Plan B and its generics have been approved by the FDA for OTC sale, I would really say on that front, the genie's out of the bottle. I don't think that you can take an OTC product and somehow stuff it back in and put it out, outside of OTC status. A couple ways in which I do think EC access could be constrained. I've already seen the Supreme Court weigh in via Hobby Lobby and Little Sisters of the Poor. Those two cases allowed employers to refuse to cover IUDs and emergency contraception because of a misunderstanding of how emergency contraception works and because of a different definition of pregnancy. Right? So they are relying on a definition of pregnancy that is the fertilization of an egg and a sperm. So that's one thing that I think many in the mainstream medical community would disagree with. And then the next thing is that they say that EC can prevent implantation of a fertilized egg. That is even on the label for Plan B and for Ella. It's not based in evidence, but it's something that has been on the label for a long time. And just now will require a tremendous amount of effort to get it off the label. And so I think, I can imagine, things like sanctuary cities for the unborn, that kind of legislation